So why don't we get started today? First of all, I'd like to introduce myself. My name is Bill Patjane. I'm the Executive Director for the APDA of Massachusetts, and welcome to today's presentation. We've received a very large response for this presentation today, and this is one of the, those questions that we get most of all at the APDA INR Center, regarding how to get quality care at home. There's been a tremendous amount of process, understanding, and treating Parkinson's disease. PD is highly individualized from person to person. Not all of what will be discussed today is relevant to everybody. What you want to do is make sure that you have a good healthcare team that is familiar with signs and symptoms, treatment strategies, and how Parkinson's disease interacts and impacts the individual patient. PD requires a team approach. Today, we're going to be providing some information, and this is not intended as medical advice. I'd like to introduce Dave and Eunice, the presenters for today's session. Dave owns Assisting Hands in Metro Boston and recently wrote a book on thriving at home. He is a Circle of Optimism participant for the APDA, and we'd like to thank him for that.
There you go.
Yeah, there you go. And Eunice is a registered nurse in the area and both have been providing services in the Boston area. Dave and Eunice will be presenting great information today. As we move forward, if you have a question, please share it in the Q&A on the chat button or on the Q&A button, and we'll take questions at the very end. We actually have a few questions that were presented before the session started, and we'll be reviewing those at the very end. And so without further ado, I'd like to pass it over to Dave Tasto.
Right. Thank you. And I'm just looking to share my screen quick, Bill. 1 second.
Sure.
And there we go. All right. I'll see that. Everything's okay? Yeah? Excellent. All right. Thank you so much for the opportunity, Bill. I'm very excited to present today in the first of this educational series. As you mentioned, I think at the beginning, we're going to be covering, accessing home care or how to find help in your home. As Bill mentioned, there are certain topics that will come up. We'll try to answer as many questions at the end, but there might be some specifics that, will require a follow-up. But please, I encourage, use the chat or the Q&A section, and we'll look to make sure we can answer as many questions as we can today. Okay. Also, Bill did mention we are, going to be providing some tips or helpful information today. It is not intended as medical advice, although, there are things that you'll be able to use in your home. Review any things that you have questions on with your healthcare providers, as they know your story or your situation best and can more accurately advise based on your situation. Okay. As far as the flow today, I'll do a brief introduction. We'll talk about how aging in place and home care relate, or getting help in your home relate to an aging in place plan. We'll cover, what is home care? How does it, what kind of help is there? What types of support there are? And then a big piece of it is just to kind of get into some common situations that folks are seeing at home. Eunice will speak to some examples that she has seen in her, herself, but also some things that are common and very similar probably to what folks, on this webinar are seeing or feeling at home these days. We'll talk a little bit about getting help. I'll give a little bit of an intro to the book that was asked about earlier, but I do want to announce that as part of today's program, if you're completing the evaluation program, we are going to give away a couple copies of my book. So I'll talk a little bit about that at the end of the program. Okay. So Again, Dave Tasto. I'm an owner at Assisting Hands Home Care. I have recently published a book called Thriving at Home, which is a handbook for preventing hospital stays, and I'll talk a little bit about that. I have recently, as part of my new role at Assisting Hands as the owner, I did seek additional certifications and did receive a certified dementia practitioner credential as well. Joining us on today's call as well is Eunice Bempong. She is our nurse at Assisting Hands, but prior to obtaining her nursing license, she had provided care, direct care for folks in her home, in their homes as a certified nursing assistant. And she has over 10 years of providing direct care to folks in their homes. As I mentioned, though, she is now our nurse at Assisting Hands, so she has, personal experience as a caregiver, but also now oversees our team providing care in homes. Again, questions, please use the Q&A, and we'll get to questions at the end of the program. So, aging in place. Home care is a key piece of an aging in place plan, but a comprehensive aging in place plan has many different considerations and elements that go into it. How to start in creating an aging in place plan, as many of us have the objective to live our retirement years, where we want to live and how we want to live. That's what I think of when I think about aging in place, just living my retirement years, how and where I want to live. If we're going to go about putting a plan in place to do just that, we have developed a planning worksheet that we can send out after the program today or in the follow-up with the evaluations. But basically, it includes starting with your objectives or your goals in retirement. What are your goals for maybe your financial situation or your home or housing situation? You could have aspirational objectives or items on your bucket list that you still want to achieve. That could be certain travel objectives or specific experiences that you'd like to have, but also family or social experiences. After we've identified those objectives, then we'll have to pull together certain considerations or elements of the plan. The elements, that we just mentioned, could be health and wellness elements, finance, transportation objectives, or supporting those goals. After we have all of those elements outlined, the specific considerations, and I'll go through an example about housing. Your objective might be that you want to move in with a family member or have a family member or members move in with you in your home. You also might want to, as other folks might want to move into a community, maybe an independent living or assisted living type community, or continue living where you're living today, more independently and on your own. These are your specific objectives for your situation and should meet what you want, your objectives. The considerations, for example, if you wanted to stay at home or have a family member move in your home, the considerations could include, I might need some home modifications. Maybe my home, my living area is on the second floor. I might need to modify certain living arrangement over time to maybe keep all of my living areas and amenities on a single floor. Or there's certain grab bars or things like that to make your home safer. We can talk a little bit more about those. You might need to outline certain things and find contractors or find folks who can help you adjust your home to be that what you might need in retirement. Obviously, some of those modifications to a home also would include some considerations for financial aspects. How might we pay for modifications or adding a stair lift or something like that? That could be years down the line, but to put that in a plan, we have to budget for it, we have to plan for it. On the health and wellness side, just quickly, some of the considerations, you might need to identify a healthcare proxy or put a trust or will in place, or you're going to have to find some legal support for that, or maybe even a financial planner to help with some of the financial planning. These are all considerations and elements that go into the plan. Some of the items that we just outlined could be managed by yourself. the approach that you're going to have to kind of outline is basically who could help with these things. Can you manage them yourselves, or are you going to need to seek additional help? These types of things you want to outline in the plan, and then you'll be able to identify where you have to seek extra help, and then proceed executing your plan. Home care, getting support in the home. If you want to live at your home, you might need some help at some point down the line. That is just one of the considerations in a comprehensive aging in place plan. We don't have to go through too many details today, but I wanted to put some context around how home care might fit into a comprehensive aging in place plan. And we'll send out this worksheet to help guide you through this process, but if you have any questions, we'll have contact information later in the presentation. So I'll start a little bit off on just briefing on what is home care, and then I'd like Eunice to add a little bit more detail in some of the types of activities or support that is specifically available in homes, just to give you a better sense of what this might look like if you're not familiar with it or haven't experienced it in the past, or have folks that have required it yet. Home care is primarily non-medical support for everyday tasks. And non-medical purposefully differentiates from medical support that of the type that you might receive from a nurse, a visiting nurse association, or a physical therapist, or an occupational therapist, or a speech therapist. Those are what we call like more of a medical support or skilled care. And home care, when we think of home care, it's more of the non-medical side. Eunice can get into some of the details in terms of the specific services that are available, but I want to also highlight that even though we're providing support for a specific person or client that might be receiving the direct care, often home care is used to provide a break for the primary caregiver. It might be a spouse, it might be a son or daughter, or a family member, a friend who's providing care for their loved one or friend on an ongoing basis. And then they need breaks. They need mental breaks. They need physical breaks. They need a vacation sometimes from the efforts that they're putting forth to care for their loved ones. When they get a break, this is referred to as respite care or support for the caregiver. So it just provides them a break. In addition, one thing I also like to highlight about home care is that it can be used for monitoring and tracking disease progression or disease improvement. As typically compared to home health care or the skilled care that I just mentioned, home care is typically in the home or working with our clients on a more regular schedule or regular basis, and can provide a monitoring in a sense because of the relationship that's developed with our clients over time, and can notice subtle changes in individuals, whether it might be just an attitude or a behavior, or even maybe a gait or how things are going. And these details, this monitoring or tracking, can be captured in our care notes and provided to family members or healthcare providers. Eunice, could you mind just giving a little bit more of an example of the types of support that can be provided in homes?
Absolutely. Thank you so much, Dave. So I also wanted to highlight that even though home care is defined as getting services at home and support at home, it could also be in a facility or a community, because that's where the individual defines as their home. So I just wanted to clarify that too.
Thank you.
So there are several services, you're welcome. So there are several services that home care can provide for an individual. One of the services includes full range of services for many aspects of everyday life. So when we talk about that, we're focusing on leisure activities. So this is defined as if you want to go out to golf, that's what your leisure activity is. But due to either disease progression or due to age and due to difficulty getting around, you need support or somebody to maintain that safety while you engage in your leisure activity. Home care services is a great way to go about it. The other way that home care services can also help you is in homemaking. So basically, home caregivers come into your home or your community, and then they help to maintain the home, making sure that there's no dust, making sure that beds are made, dishes are put away, laundry, everything that we do in our everyday life to maintain our homes and to keep them safe and sanitary, that's where home care services come in. Also, we look at safety getting around your own home. So as Dave briefly touched on, as we get older, our homes become, a place where we want to be able to get to things. But because of the structure of how our homes are, it becomes unsafe sometimes or even difficult for you to get around your own home environment. So home care services provide that support where things can be rearranged, or somebody can be in the home while you get around your kitchen, get around your bedroom, get in and out of your bed to maintain your safety and to make sure that even though you're still in your home, you're being safe. The other area is grooming and personal care. So one of the things that I like to do personally is to make sure that, I'm well groomed. Personal care is one thing too that home care services can support you in. So for example, making sure that your nails are trimmed and filed, making sure that we're moisturizing, we're, helping you with your hair care needs, making sure that your clothing are all laundered properly. So these are all areas that home care can support you. Also, medication reminders and verification. So home care services help you to remind you in case you forget to take a medication. Also to verify that the medication that you're taking is exactly what you're supposed to be taking at that particular time. We also touch on transportation, going to and from doctor's appointments, going to and from leisure activities, to the restaurants, to church activities, anything that you need transportation to go to and from, home care can support you in those areas. And then respite care. So I have a little story of my own. When I started working as a direct care CNA, we had a family come on board, and the primary caregiver was the individual's wife. So she had been doing this for a very long time, and she was mentally exhausted. She was very stressed out, and she was almost at a point where she could not function because she had been doing this alone for a very long time. When we went into the home to support her and to provide that extra break for her, it was very rewarding for her to see us come in. She was always thankful for me coming into her home. And she told me how that gave her a little time for her to get out of the home and get her hair done. And for some loved ones providing care, it's a relief for them to know that there's somebody in there who can provide safety and maintain the home while they're away, also trying to take care of themselves. So this is some of the ways that home care can be beneficial to many folks. Some of the common situations that we tend to encounter when we have people coming on board with home care is fall risk. So falls are one of the biggest reasons that folks tend to go into the hospital. Again, because their homes might be familiar to them, but things that are in place in their homes are no longer compatible with their age, as well as their disease progression. So another example, I had a client who, when I first started with, he had, for the sake of privacy, I don't want to mention the person's name, but this person had a fall risk where they could not go to and from the bathroom. They had the urgency to go into the bathroom, and so in a rush to go into the bathroom, they would experience falls. So they contacted us to provide services for them. One of the things that I noticed right away was they did not have access to their wheelchair, where they couldn't reach it enough to bring them to the bathroom. So we identified this. The other thing too was they did not have raised toilet seats where when she goes to sit down on the toilet, she could not get herself back up. So again, being there, we were able to support her in this area. We were able to identify all these areas that could help her to live in her own home while still maintaining her safety. So this is another way that healthcare can be very helpful and supportive to folks in their own home environments.
Thank you so much, Eunice. And for those folks here, we did send out, it's called Help at Home Common Situations. It provides an example of some of the situations that we see, that are more common in homes or within families these days. You might have something similar. You might have your own situation. It's not a bad thing to kind of just jot down your situation so that you can kind of look at it objectively to understand what elements that what you have to adjust, or considerations that you might have to take care to improve your family or situation at home. So again, if there's any questions about your specific situation, we'll try to go into some at the end during the Q&A, but we might need some follow-up. Okay. So getting help at home. So if you're, folks on this call are probably attending because of the topic, but how do you go about this, right? What are the areas you want to look into? What kind of things do you look for in a company? This is really what, kind of the meat and what we want to kind of cover today, and make sure that any questions you have do get answered or addressed. A key thing though, before we get into how, is start early. So hopefully some of the folks on the webinar today are researching maybe even before they need it specifically. So if you can establish a relationship with a firm or individuals or whoever you might need before there's a crisis or an emergency, or before there might be a fall that you have to kind of reach out immediately. Establish a relationship, build some comfort level with a firm who can work with you over time, understands who you are, so that when things do change and you might need a little bit extra support, there will be someone there who knows your situation, is comfortable, and can well match some support to your specific needs. As far as I can cover actually some of the questions. Eunice, do you want to maybe go through some of the attributes that you would be looking for, and some of the things that we've seen that are critical in looking for help in homes?
Absolutely. So one of the critical attributes is communication. So as we talked about, most folks live either by themselves in their own homes or in a community. And so the home care agency should be able to communicate with family members that are out of state, that are not living with the client. And our specific company, we have a system called Access Care, where we have the family members and the client themselves go through our care notes, which is the caregivers that go into your home. They're able to communicate with your progression or improvement in your disease condition, tracking how you're doing on everyday activities such as eating, such as how you're sleeping at night, how you're moving about in your own home, things that we think are safety risks. We're able to communicate all that through the care notes. The other thing too is caregiver qualifications. So we have a very high standard, and we make sure that all the caregivers that are coming on board, they take a quiz first of all to make sure that they're up to par with the role that we're assigning them to. We also have training modules for them to keep them up to date with their trainings. We also do supervisory visits where I go out to make sure that caregivers are adhering to their trainings and making sure that if they had any questions or if they had any concerns, those could be addressed. So we take into consideration all these things before we hire our caregivers. Caregiver support, we also make sure that our caregivers, anytime that they had questions or concerns while they're in a client's home, they're able to reach someone in the office right away so that those questions can be addressed. It could be anything from their own personal issues or having difficulty with certain situations in the home, or if they need a clarification, they always have that support in the office. The other thing too is the approach. So we make sure that we're having caregivers who have decent amount of experience coming on board. We're also making sure that we are approaching it from an individualized perspective. So when we come in to do an assessment with you, we make sure that we find out what your goal is, where you're at in terms of your medical history. And then we also make sure that we have a point of contact with your family. And the family member too has one person in the office who is able to address all their concerns. So every time that you call the office, you're going to get that one specific individual who's going to be able to coordinate everything and make sure that all your concerns, all your expectations are being met as we discussed during your assessment. We also do a safety check in your home when we come in to do an intake for you. We make sure that when we come in and we see anything that can be a safety risk, we make sure that all those are addressed before we start providing services. Again, to make sure that our caregivers are being kept safe while they're in your home, and then also making sure that you're being kept safe in your home, because these are things that we as professionals, we will be able to identify. And then again, we talked about the hiring criteria.
Yeah, I can talk. Yeah.
Okay.
Basically, what would you want to get a feel from or get a sense from whoever you're contacting, looking for support at home, is that you want to understand that the folks they're going to be, sending into your home or that of the loved one are folks that you can trust, right? Trust with the care for your loved one. How do you get there? It's, Eunice mentioned a lot about the credentials, the certifications. Another great question that we ask when we're hiring folks is, why did they get into the field? Why did they become a caregiver? And just gauging their rationale for entering the field provides some insight, whether it was financial or whether they cared for a family member and they just loved what they were doing, and their face lights up when they talk about bringing smiles to folks. Eunice mentioned some of the, the exams and the credentials, whether the caregivers are certified or not certified, whether they have a credential like a certified nursing assistant or a certified home health aide is another thing to look for. Eunice mentioned as well, just to kind of reiterate a little bit, the communication. Families is very critical to make sure that the families are aware and understanding what's going on, but also so that maybe the primary caregiver doesn't have to relay the message to 4 or 5 different siblings of their children. It can be a communication bottleneck, to kind of go through and constantly asking the primary caregiver how things are going, how's dad's doing, how mom's doing. So having alternate methods to communicate is often very, very helpful. And then that care advocate, as we have internally, someone who is able to understand your specific situation and communicate any updates or changes back and forth to either your primary care or connecting into some of the other skilled help at home, whether it's a nurse or a physical occupational therapist. One thing I want to highlight, Eunice touched on just after we do the assessment in the home, is to understand your specific individualized plan of care, but then taking that information back and comparing to our roster of caregivers on who would make a great match, not just in, if they have either Parkinson's experience or dementia or whatever types of conditions exist, but also personality styles, whether they want to be engaging or what types of hobbies or activities does the person like or enjoy. We ask a lot of questions during our assessments in homes of our clients, but also we get to know our caregivers very well. So these are the kinds of things that you're going to want to ask whoever might be that person coming in to help out. Is it going to be a match personality-wise and interest-wise? Because often there's a bond that you want to develop between the person who's caring for your loved one, just as much as you would be doing the same. Again, if there's any specific questions on looking into qualifying or hiring, we can answer those kind of specific questions at the end. As I mentioned, Eunice talked a little bit about our approach, but at Assisting Hands, we are focused on keeping individuals thriving at home, specifically in helping prevent them from going to hospitals. To us, thriving at home, the approach that we take is really ensuring smooth transitions into or out of hospitals or rehabs. A key piece to aging in place at home is to maintain your independence. And that means still doing everything you're able to do as long as you're able to do it, and only getting help for those things that you do need specific support for. If you're able to cook meals at home, but you just need a little bit of help cutting up some vegetables, then that's where we can help. If you can shower on your own, but you just need a little bit of help rinsing or washing your hair, that's where we could help. But the rest of the shower, the rest of the bathing is what you can do, and maintaining your strength, your ability to function independently at home is a key piece to, that thriving at home. But as far as the book, what is inside the book and how can it help specifically, keeping your home safe as Eunice was talking about in terms of fall, the client that she talked about with the fall risk, there's a lot of specific things you can do. And I'll get to a little bit more as more of an example of what's inside the book regarding keeping your home safe. Managing your condition at home, 1 in 5 Medicare patients go back to the hospital within 30 days. These are just generally known statistics. And if you do have a chronic condition such as heart failure, stroke, diabetes, or chronic obstructive pulmonary disease, certain chronic conditions put you at an increased risk yet for going back into the hospital. So if you understand what symptoms are common, you can actually manage by the exception and understand which symptoms are abnormal or not, not something that would need or require an escalation to a healthcare provider. So it starts by knowing which ones are common for your situations. And then when you experience abnormal symptoms or abnormal pain, that's when you would need to escalate. In going to the hospital and making sure that we avoid that return trip to the hospital, going to the hospital and preparing for a trip can definitely make the experience much more pleasurable when you're set up with what you need to bring to the hospital. There's a checklist in the book on certain things like bring your medication list. As often, particularly for folks with Parkinson's, medications are required at specific times of days or days of the week. And we want to make sure that the information that the hospital gets, they have that information because they will be taking over your medications when you go to the hospital. So making sure you bring a medication list, healthcare proxy information, someone who could make decisions for you if you're not able to, as well as insurance and all these other things are very helpful to bring with you to a hospital, along with leisure activities like puzzles and games and your phone and chargers for your phone so that you're able to stay in contact with your loved ones. As particularly these days, you might not be able to get a lot of visitors. So bringing things that you're able to do on your own and keep yourself engaged and informed with what's going on outside of your world in the hospital is a very important thing. So that's, just in preparing for a hospital stay can hopefully improve your outcome, but for sure the experience while you're in the hospital. A very important piece, though, to ensure that you don't end up going back to the hospital is to make sure you have a plan for a very smooth transition home, whether that's a transition into a rehab and then home. But there's a lot of details to be mindful of when you're discharging. There's possibly new medications, making sure that the medications are available and picked up from the pharmacy. When are your follow-up appointments with your primary care providers? Do you have transportation to those providers? Are there questions that you're going to need to need to ask the primary care? In the book, there's a list of questions that you could bring to your primary care provider. Some of them are similar to what you should ask upon discharging about common symptoms. So remember, managing your condition at home is to understand which symptoms are common or should be expected given your situation, but that will also inform you and your care partner, your family members on what is not normal and when you should need to escalate. These things, knowing them, could help you avoid going into the hospital. And it could just require a trip, a call to your primary care provider to understand and assess the situation. Also in the book, we're covering a few key pointers today in terms of finding extra help at home. There's a section as well in the book that goes a little bit more detail, has a list of questions that you can ask as well of folks. A lot of that is all covered today, specifically about finding, care in homes. But the key thing is that we want to keep you healthy and happy at home, support your desire to age in place or live your retirement years where you want to live. So to touch on keeping home safe, I think Eunice mentioned that the #1 cause for trips to the hospital are in fact trips or falls in the home. So preventing falls is a big deal, a very important piece of supporting our aging in place plan so that we don't have to leave our home, go to a hospital and possibly into a nursing home or rehab community or facility. How do we do that? We first need to be able to see hazards in the home. And seeing hazards in the home has two primary components. First, sufficient lighting, and making sure that we have lighting in the rooms that we're going to be in before we get in the room. So that means having light switches or lighting that's accessible before we get into the room, and that we're not walking into the room, finding our way to the couch, flipping on the lampshade or the lamp. You know, you can't get into the room and then turn on the lights because you can hit hazards along the way. Also, in able to see hazards, physically we need to see them. As we age, our eyes do deteriorate, and getting regular checks is very important to maintain the ability to see the hazards, because things can change, shift around. Pets are notorious for moving objects in homes, and even being aware of where a pet is at so that we're not tripping over a pet. Looking at the house diagram on the right side here, there are a lot of supports that are kind of shown in the various rooms. Some of those are grab bars in the bathroom, near the toilet, or near the bath or shower. But also in the bathroom, if we're sticking in the bathroom for a second, there's towels that are hanging and are easily accessible should there become a slip hazard on the floor. Like if we spill liquid or liquid spills onto the floor like water, we can quickly wipe it up with an accessible towel so that we remove the hazard as soon as possible. We aren't going to slip on it. If we look in the room up to the right, the bedroom, the floor is clear. The bed is at a lower level. It's not elevated, making it difficult to get in or out of. In the kitchen area, again, towels are accessible for any spills that might happen in the kitchen. One note on the kitchen, though, as far as making things easier to access, if commonly used items like bowls or mugs are placed in cabinets that are a little bit hard to reach, placing them upside down on the countertop could be a simple thing to do, but that would make, not reaching or stretching, causing us, the chance to be off balance or only on one leg or on our tiptoes, could help prevent falls as well. Lastly, as far as in the picture here, I want to point out that on stairs, it's helpful to have railings on both sides, not shown in here because of the diagram, but having railings on both sides of the stairs can help ensure that whether it's going up or going down, if we have a strong arm or a strong leg, that we're always supported and we always have an easy access to that support while we're going up and down stairs. And remember, going on stairs, yes, any transitions between floors or objects in the home can cause increased risk. But remember, we want you to maintain your strength, to maintain your independence at home. So continuing to do as many things as you normally do is a big piece of maintaining your independence and supporting your aging in place plan. Exercise, though, is also a very critical piece to maintaining your strength and balance so that you are able to move around the home safely, as Eunice was talking about, particularly, if there is a fall risk. So maintaining balance, and there's a bunch of resources, even through the APDA, in terms of exercise, different courses, even online now with Zooms and so forth. Okay. So leaving 15 minutes or so, we want to make sure that we do have time for questions and can go through. So I'd like to, there you go, Bill. But while we're going through questions, there is contact information on the screen here for more information about the book. But also, if you do need to reach out to the APDA, the helpline is there as well as Assisting Hands contact information. But Bill, I'll hand it over to you to kind of facilitate some of the question and answer.
Thank you, Dave and Eunice, for presenting today. It was wonderful information. I'm going to try and encapsulate the questions in categories. And one of the categories that I think is important is that we've gotten some questions regarding how do I find, contacts outside of the Assisting Hands, coverage zone. And one of the feedback points for that is that there certainly are different organizations out there. One is there are many home care agencies in the local, in various areas. We also, the the Agency on Aging is also a good starting point, as well as some senior centers. And Dave, do you want to respond to that question also?
Yeah, I think you mentioned the Area Agency on Aging or All Service Access Point. Basically, the elder services, it's a state kind of directed or overseen agency that can help refer you to folks in your communities. Yeah, so there's like 26 of these agencies, I think, around the Massachusetts, but each state should have other resources as well.
Yeah,
if we have out-of-state attendees.
The other question is, services for overnight care. Do the organizations offer that?
Yeah, for sure. I don't know, Eunice, if you want to give an example of why somebody might need some overnight care.
Sure. So there might be individuals who have difficulty going in and out of the bathroom in the evening, who might need that support. There are some disease conditions too that come with difficulty sleeping or staying asleep, or sometimes too, there might be individuals who just need that safety companionship in their homes at night. So these are all reasons to get that services. And there are so many home care services that do provide overnight support for folks.
Mm-hmm.
Yeah, thank you. The other question is regarding payment options and cost. Are the services covered by Medicare?
Not. There is a small resource that is available through like a Plan B on Medicare, but that would typically only support the services of a visiting nurse or physical therapist or occupational therapist, and typically it would only be like a 1 or 2 hour visit, maybe a week, or maybe multiple times a week. Additional Medicare and Medicaid or Mass Health, as it is in Massachusetts, the Center for Medicare and Medicaid is looking into additional resources. Even just as of yesterday, they announced a focus on trying to help states offer more support in homes. But some Medicare Advantage plans are now supporting in-home care. They just rolled out maybe a year or so ago, and some of the plans are just coming on board with that. But if we step back and kind of look at a couple different ways to pay, you can pay privately out of your savings or your assets. There's various financial means to look into this, and financial planners can assist with reverse mortgages or other types of ways to help pay. If you have an asset, how can you use your assets to get to age in place and use your assets to continue living where you want to live. Also, there's veterans programs available. Mass Health, as I mentioned, Medicare, calling those all service access points or the state elder service agencies are ways to access support for folks that might not have the financial means to pay privately. And typically some of those support services are on a sliding scale. So depending on the income or asset level, there might be different levels of qualification that you could receive. Lastly, long-term care insurance is also a way to pay for care in homes or in communities as well. And that is a special type of insurance. It's not your standard health care or standard health insurance, but it's a special policy that you would have. It's called long-term care insurance, but that can also be used for paying for care.
Thank you. Another question that we have is, can you describe the security or background check for the employees that are going into the home?
For sure. No, it's great. In Massachusetts, it should be almost a requirement that everybody would have a Massachusetts, we call it a Massachusetts CORI check, which is a criminal registry check. But some agencies, we actually perform a national criminal and background check because particularly in New England, our states are close, and we're located in Bedford, but New Hampshire is only 20, 30 minutes away, and we want to make sure that even if there's an issue in a nearby state or in a previous residence of an employee, that they're not going to be somebody we can't trust in a home. As well as if they're doing transportation, we'd provide a driving record check as well.
That's great, thank you. And one of the Next questions is regarding COVID and how you're handling COVID. Could you
Great question,
describe
and
that
that's
at
a
all?
thank you. Maybe Eunice, I think you probably want to give a little bit more information on this topic.
Sure. So even prior to COVID, we had always had training for our caregivers where we trained them on proper hand washing, making sure that they are sanitizing, adhering to personal protective equipment, which is putting on gloves when providing care and all those services. Now we have intensified that training where we are making sure that caregivers know how to put on face masks properly, making sure that they're staying safe while on with our clients and away from our clients. We're also making sure that we're limiting the number of caregivers that go into our client's home. So this serves us for two reasons. One, for contact tracing. So let's say if our caregiver or the client were to test positive, we can track it back to how many caregivers were going into their home. So that way we can keep the client safe as well as the caregivers safe. We are also implementing several other precautions based on the CDC recommendations to make sure that our caregivers and our clients are safe. Because COVID is something that we're all kind of trying to figure out, how to maintain our safety while still, fighting this global pandemic. So.
Yeah, we're taking COVID very seriously, particularly as cases, in the U.S. or in Massachusetts are increasing. It is a very serious thing.
Yes. Another question that we have is, can caregivers go to the doctor appointment and assist in keeping track of medications? And can they speak to the doctor on behalf of the patient?
I can take that one. So our caregivers, like we already identified in our presentation, they do provide transportation services. They do go in and out of the doctor's office with our clients. We do want to maintain our clients' individuality where they're able to communicate with their doctors on their own. But if you do want the caregiver to advocate for you, we can absolutely have the caregivers advocate for you. Again, they're also there to trace or track the improvement of your disease progression, as well as if it's deteriorating. So all these care notes that you're taking while you're on shift, they will be able to provide that to the doctor's office to kind of help them to know what to do in terms of helping you with change of medications, change of therapy, and treatment regimen to help with, identifying what can help you with your specific situation.
One note on the meds, Eunice, I think you touched on a little bit, but just noting what was taken, but also verifying that it was taken and that it wasn't, put into the mouth or tried to attempt to put in the mouth, but then fell in and is in the couch sofa, or it's actually verifying that those meds were taken at the right time, and then just noting it in our care notes that so it's verification of medications as well.
Yep. Thank you. Next is, do you offer home care that stays overnight? And we've gotten that question a couple of times. And how does that work? And additionally, is there an opportunity for live-in home care? And another question regarding the continuity of the caregiver into the home. So I think those kind of fall within the same category.
Yeah, I can start, and Eunice, feel free to add. But the questions were brought up is highlighting, I think, the overnight, but also live-in. Live-in caregiver is slightly different. Typically, home care is like an hourly service. So families or clients will be paying by the hour for the care. The live-in is different in that the same caregiver would stay there for a 24-hour period or multiple 24-hour periods in a row. Like moving in, bringing their clothes, their change of clothes, that person would need to shower, clean up, dress, eat, and so forth in that same home, along with the client. Okay, those charges for those are typically charges by the day, in a sense. But those caregivers would stay in the home. One of the things to consider, though, is if the caregiver is coming to live in the home, and there is a need for care overnight, meaning I think I heard one of the questions about, somebody waking up at night or multiple times at night. If the caregiver is going to be living in, we want to make sure that our first priority is safety of the client. And so if a caregiver needs to wake up at the same time that the client is up, then when is the caregiver sleeping? So we want to make sure that for a live-in arrangement, that the caregiver is able to sleep a certain number of hours continuously, and then maybe having the right breaks throughout the day, so that they can provide the care when it is needed. Does that answer the
Yes.
questions there?
Yes, yep.
About live-in and overnight? Yep.
Yep. And then the other question that we have category is cost, and how do you find affordable and reliable help with a limited income? And so can you describe that?
Okay. So, I mean, we'll get to the cost, and there's a range I can provide, but again, reaching out to the elder services are great resources in the community. So the all service access points, as they're called in Massachusetts, or the like Minuteman Senior Services or Elder Services of the Merrimack Valley, just to name a couple. These are great resources, as well as just calling in the helpline with the APDA, as we're seeing here on the screen, just to ask questions and understand where to look, how to find it. But rates can range depending on the complexity, from high 20s to mid 30s an hour.
Yes, and I wanted to jump in and just say that the APDA of Massachusetts has some additional resources available to people in need. So if you have any specific questions regarding need, please reach out to us. The Massachusetts chapter, the helpline is listed there on the screen. We certainly would love to hear from you, and additionally, we want to try and provide as much support as we can. I think that at this point, we've answered all the questions. I want to thank the entire staff, Dave and Eunice, for today's presentation. This is part of a series that APDA plans to roll out over the course of the next 6 months. It's our hope that we'll be identifying different types of presentations that the community is in need of. This was fantastic information. This is a one point and a multi-step process. Please reach out to the APDA of Massachusetts if you have any questions. As a follow-up, we're going to be sending out some information. We'll send out the slides, as well as we'll be sending out an evaluation. And part of that evaluation is we'll draw from the individuals that do the evaluation and give out a couple of Dave's great book, Thriving at Home. And we really appreciate all the information and the Q&A, and we hope that this will be a step in a long-term relationship with all of the participants and APDA.
Thank you very much, Bill. We're honored to have the opportunity to help out.